Welcome back to Coffee with Ravi. Today our guest on the show is Mary Greenley. Mary Greenley works with Cedar Valley Medical Specialists and is in charge of the entire billing collections operation. We in healthcare are largely guilty of not having a transparent, easily explainable billing process, and one of our goals at Digestive Health is to provide two things. To be able to provide a non-confusing, clear to understand billing format, and two, hopefully to have you understand how the economics of prices work as it relates to digestive health. So from the first standpoint, we're glad to do that in terms of having one bill available for you to view. Mary, do you want to kind of touch on that as to this one bill? How is this important? How is this different from getting bills from different providers? Because there are different services that take place. How will you walk us through that?
Sure. So at Cedar Valley Digestive Health, the patient is able to see not only the physician, the surgeon, nurse practitioners, but also when they are having a procedure here, Dr. Ravi has coordinated anesthesia services through Cedar Valley Anesthesia. Pathology is also done here on site, along with any radiology services that may need to take place at Advanced Diagnostic Imaging. So as a patient receives those claims and they're processed, they all come on one bill.
Because sometimes, because with patient care, different people collaborate, but it's also nice to receive one bill from the patient standpoint, because I know I've been confused in terms of getting 3 different bills from 3 different providers for what I view as one service.
That's correct. One statement, if there are questions, one phone call, one payment if necessary.
Okay. You had a slide that you wanted to show about all of that in terms of, will you walk us through that in terms of what one bill looks like?
Sure. So as you'll see from this statement, it will show you the billing provider along with the services which took place. So it's a line-by-line summary showing what service cost was, what the payment was from the payer, and what the patient's responsible for. And it's broken out by provider.
So they'll know that this is what the patient responsibility is, this is what the insurance responsibility is, say for one problem that they come in that requires different providers to coordinate their care.
That is correct.
Yeah.
Mm-hmm.
How could we get to a point where the patients would know what their responsibility would be before they come in for a set of services? That would be ideal. From a patient standpoint.
It would be ideal, and we do a lot of cost comparisons for the patient. So we will have patients call and inquire about what the cost would be. We will reach out to the payer to find out what their deductible is at, what their out-of-pocket may be at, and do some cost estimates for them at that point.
Good. Because I think our goal is for you to understand what your responsibility is, what you're walking into, and to explain this in a very non-confusing, clear-cut manner. That's what we are progressing towards. Mm-hmm. And with that in mind, I continue to re-emphasize that as it relates to the insurance, as it relates to all of you, we are at the lowest price point possible within what is available within the healthcare industry.
I think one thing to point out too is your efficient services that you're providing here. It is passing a cost savings on to your patients. So if they come to see you in this setting, there are no longer facility fees that they'll see. Your services are typically about 50% less than other facility settings. So it is cost savings to the patient and to the payer.
Good. Yeah. Thank you for joining us today, and we hope to see you again next week.